This is Dr. Gary Groff at Groff Dental Studio. At Groff Dental Studio, we use the Velscope to detect abnormalities in the oral tissues. This is the oral cancer screening that you will receive in our office. Today we're going to do an oral cancer screening, and we do this once a year on all adults. I'm going to use a special light that helps me see things sooner than I otherwise would notice them. Hence, OSHA says you need to wear the safety glasses. So, this is kind of warm and it makes noise. Don't be surprised. Go ahead and open for me. First we'll look at the palate all the way around. And back in the back. Now, say ah for me. Ah. Very good, very good. Now, relax your jaw so I can stretch your cheek. And we'll look at the sides. And we'll go to the bottom arch on the same side and look around. This just helps us to identify abnormalities well before we might otherwise see them. That's not an indication that you certainly have a problem, but it gives us a starting point to look at, and if needed we can refer to an ENT or back to your physician or whomever you choose. Okay, that all looks normal. Now, also under the tongue is a common area for problems to develop. So raise your tongue to the roof of your mouth, and you might want to zoom in on that. What you notice in there is a field of green, basically. The tissue will absorb the light and reflect it back out. Okay, now lastly, and this is the fun part, Annette, stick your tongue out for me and I'm going to grab it and roll it over and look underneath in the very back. That's another high risk area for people. Fortunately, I don't think you've taken up chewing and everything looks normal. I don't have any concern. If there were a concern, it would show up in this lens as a dark area in that field of green that I described. Cysts, tumors, cancerous cells will absorb that light and not reflect it back out, and it just looks like a void. Healthy tissue will reflect that back out and it looks green.
Cool.
So,
good to know.
As far as the oral cancer screening goes, you're normal today.
Awesome.
Just don't start chewing. As you noticed, we just looked over this patient's mouth and fortunately didn't find any signs of areas that we were concerned about. That is something we take seriously, and April happens to be Oral Cancer Awareness Month. If you have any concerns or would like a screening, call our office at 660-885-6911. We'll schedule an appointment. Thank you.